الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hepatitis D or Delta Hepatitis by Professor Mahmoud Hani Sulaiman. Virology. Hepatitis D virus is a virus-like particle consisting of a coat of hepatitis B virus, HBV, surface antigen and a unique internal antigen, the delta antigen. Epidemiology. Hepatitis D occurs worldwide and is most prevalent in countries with high incidence of hepatitis B. The highest incidence in parts of Russia, Romania, southern Italy, Africa, pockets of South America, islands of Western Pacific. Despite high rates of hepatitis B in Asian countries, incidence of hepatitis D is lower. Reservoir. HDV is unable to infect a cell by itself and requires co-infection with hepatitis B virus to undergo complete replication. So, humans with hepatitis B virus infection act as reservoirs. Mode of transmission. Transmitted by the same methods as HBV, that is to say, exposure to infected blood and body fluids, contaminated needles, syringes, or blood and plasma product transfusions. Sexual transmission, but less than with hepatitis B. Perinatal infection is rare. Infection may occur as co-infection or super-infection. Period of communicability. This is similar to that of HBV. Persons infected with HDV are thought to be most infectious before the onset of symptoms. All persons with asymptomatic infections, persons with acute disease, and those with chronic carriage of the virus are infectious to others. Susceptibility and resistance. All people susceptible to hepatitis B infection or those who have chronic hepatitis B can be infected with HDV. Incubation period 2 to 8 weeks. Clinical features. Onset is abrupt with symptoms and signs as those of hepatitis B infection. Super infection with HDV is usually more severe than HB infection alone and more likely to lead to fulminant disease. Co-infection has a lower risk of severe chronic disease than does super infection. Diagnosis. Detection of total antibody to HDV. A positive HDV IgM result equals ongoing replication. HDV specific RNA by PCR is the most sensitive assay for assessing HDV viremia. Prevention of hepatitis B infection with hepatitis B vaccine prevents infection with hepatitis D. For persons with chronic hepatitis B infections, only preventive measure is avoidance of exposure to potential sources of HDV. This means always using a new needle and syringe when injecting drugs and practicing safe sex. Treatment. There is no specific treatment for hepatitis D, although alpha interferon was shown to be of some benefit Expert advice for treatment should be sought. Isolation is not required. Educate patient about safe sex, blood and body fluid precautions. Case control, initiate contact tracing with patient susceptible sexual injecting and household contacts, susceptible contacts that have sex or injections, common share, and household offered hepatitis B vaccine. Control of environment, outbreak measures not applicable. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.